In my role as a consultant is I'm going to ask them about progress on the interventions. And so let's go to that. So when a family comes in before graduation, you want to say, okay, let's review the interventions that we've done and let's see where you are on the progress scale. This is an important first step in relapse prevention. So these were the main interventions that were used by Michael as a coach. These are called strategic directives, or what we affectionately call as trauma playbooks, to put in the missing healthy undercurrent. In this case, there was lack of attachment. So Michael gave the mom especially an intervention called the Positive Dexter Report, which is to catch Dexter doing something right and start to change the dance between especially mom and son. And mom's going to talk about that a little bit in just a moment. Then the other intervention was that this was the first time that they had actually defined disrespect in writing. Before FST, it was off the cuff. They made it up as they went along. And she's going to talk about how just this one thing really helped, where they had it pre-written, and this helped calm things down tremendously. So in a very solution-focused way, you put up on the board, or if you're doing telemedicine, you would show this slide, but you say simply on a scale of 0 to 100%, how much progress are we making on these two interventions? 0%, no progress on the positive Dexter report, and then or 100% maximum progress. And with the disrespect contract, how are we making progress? And you want the client to actually say, what am I doing right now that's positive, that's preventing my number from going lower? So if the parent says 70%, why isn't it at a 60, 50, 40%? And you're actually writing this on the board so that the client is like consolidating the gains. Like, oh my God, I made some gains in treatment. I can put words on it. And then, of course, you go, well, what concrete steps do we need to raise the overall percentage? Now, if a client says to you, well, we're only at 20%, but we're ready to graduate, you can point to the board and say, not so fast. I don't think you're ready to graduate because we need to get this 20% up to 80%. It's what's called a measurable impact. And so this is a great litmus test with you and the client to say, we want to be at that 80, 90% range with each intervention. Maybe you do one, or in this case, we have two, so that we're feeling more confident that you are ready to graduate.